You can get it in foods, although it's difficult to get the amount of amino acid you need by eating foods. For example, salmon is rich in tyrosine, which helps produce dopamine and norepinephrine. But you'd have to probably eat 5 or 10 pounds of salmon a day.
Is that why we take fish oil?
No, that's a different reason.
Okay.
Fish oils are used primarily because of the fat in them, and that fat happens to be anti-inflammatory. The portion of the fish that I'm making reference to is the amino acids. Amino acids are the building blocks of neurotransmitters, but also of your muscles, for example. If you string them all together, you can create muscle and other structures in the body. So probably the best way to get them is through supplementation. Obviously, you want to eat a balanced diet. White fish, for example, is high in tryptophan and will help raise your serotonin levels perhaps ever so slightly. But in people who have severely depleted themselves, you generally need supplementation, unfortunately.
And how do you know if you are depleted? Is that
a good question?
Is that the blood work that's involved, or
well,
testing?
it's hard to tell. The levels in the bloodstream are transient. If I come at you with a needle, your adrenaline levels are going to go up, and if I measure it in the blood, I might see actually a high level. So there are labs that are beginning to look at doing urinary neurotransmitter levels. Now, the disadvantage of this is that we're several compartments away from the brain, but nobody wants to do lumbar punctures and measure cerebrospinal fluid levels because it's invasive, number one. But there are studies showing that you can correlate somewhat urinary levels with beneficial clinical outcomes. One of the statements that was made in the University of Minnesota study was that there were paradoxical reactions. For example, giving tyrosine did not always elevate dopamine levels, whereas when you gave tryptophan, you actually elevated serotonin levels in the urine about 50% of the time. And it's a bit more complicated than we probably have time for on the show, but there is a growing body of literature showing its benefit. There was a nice chapter published in a book from Johns Hopkins recently, published by CRC Press, on depression, the use of amino acids. And there are other studies coming out showing how physicians can begin to deal with that, but it's a work in progress.
All right, we have some more slides to go through, so let's continue with the slideshow here. Chemical brain injury, and that looks like a person in distress.
Yes, cover of one of my books. But the point I wanted to make with this slide was recently a study published in the journal The Lancet, which is one of the better journals out there, by Dr. Grangian, who is at Harvard, showed or his conclusion after looking at the data from his study was that industrial chemicals, may actually be impacting the brains of children in utero to the tune of millions of children, and maybe contributing to autistic features, attention deficit disorder, as well as mental retardation. And he found that out of about 80,000 chemicals that he looked at, there were 1,000 or so. In fact, if you could go to the next slide, we can look at that directly. 1,000 of those chemicals were known in experiments to be toxic to the nervous system. 200 of them were, in fact, neurotoxic to humans, and out of that, there were 5 that were clearly neurotoxic in the developing fetal brain.
All right, and these chemicals come from where? The environment?
Well, they come from the environment. They come from industry. The one that tops the list is lead. In fact, lead was number 1, methyl mercury was number 2, and arsenic was number 3. But solvents, toluene, even alcohol, of course, fetal alcohol syndrome, most of us are aware of. But they estimated that the loss in economic productivity of these children as they grow is in the billions. He estimated, in fact, for lead that it was somewhere between $100 and $300 billion per birth year for these children that had been affected by lead.
Okay, then how do you avoid lead exposure?
Well, you know, a lot of that has been done. Most of those people, or most of us, are not being exposed to lead to the same degree that than the people in his study. He was looking back over the last 20 or 30, 40 years. So lead, you know, we no longer have lead in paints and gasoline, et cetera, but it is fairly pervasive, and it is still potentially a big problem.
How about just exposure to chemicals?
Well, again, and that's one of some of the commentary in his article was interesting. He said that there were probably 3,000 other industrial chemicals that were suspect. And out of that group, less than half of them had actually had neurotoxicological studies performed on them. And they were being produced at the rate of a billion pounds per year, each chemical is, and being spread and used in industry. And some of them were pesticides, et cetera.
Okay, just not in industry, but how about in our diet, in our food? Is that why organic is such a buzzword today?
Yes, potentially in the food as well. But you have to be careful with organics. There are some places that have gotten their fertilizers from battery assembly plants, and they've got toxic amounts of cadmium. And there was a paper 3 or 4 years ago showing that it's important, even in the organic world, to adhere to the highest standards. And the second on the list was methylmercury, and methylmercury is in fungicides and paints. Arsenic is as well. It's part of the molecule that helps to kill mold from growing on the wall, so you have to be careful with that as well. So
it seems that perhaps it's
pervasive.
all out there.
It's pervasive. And lead stays in your bones for basically your entire life. It's very difficult to remove. Now, in the defense of those who are critical of lead as it relates to ADHD, there was a paper in the New England Journal some years ago showing that even though these children were chelated, which is an amino acid that removes the metal, they did not improve. Now, there are other...
Wow.
And so it's not clear completely the connection between the heavy metals and their all of their neurodevelopmental problems. I can say I've seen the flip side of that too. When lead was removed or mercury was removed, we have clinically seen some patients improve.
Okay, let's go ahead and go through a couple more slides. Our phone bank's beginning to get full here.